Good afternoon, everybody. If we can, go ahead and put your name in the chat box that we'll have it, copy and paste it for attendance records. Thanks. And Mr. Curtis, you're here. You actually got the email? I'm so impressed.
Yes, I actually got the email. I'm actually at home too.
Must be nice.
Yeah, I'm under the weather since yesterday, so I'm
sorry.
But you're so special. I'm here.
Oh, yeah, thank you, sir. Thank you. We got to being recorded, so put on my best behavior. We're not going to have a lot. We're got some assignments made for some things that we need to schedule coming up, and but we'll give it another minute and then we'll get started. I know several people are not going to be here today, so that's going to make it a little bit shorter than I would have hoped it to be. But it's the day before a holiday weekend, so I guess we deserve a little bit of a break.
Yes.
And Ms. Mary, we appreciate you stepping in to be here on behalf of Miss Sarah, who's also here. So now I'm really confused.
I'm just going to be here for a few minutes.
Okay. Yeah.
And I'm sorry we haven't been able to join any. They just have always overlapped with other meetings. But
well, I was going to say, if Miss Mary is the homeless liaison, would she be a better fit for the board? Would that be better for you guys?
More than likely. So that's why we're both kind of listening in today. She thinks that she was a member of the board in the past, but she wasn't really sure.
Cool deal. All right, Lakita's joining in, so we have to quit volunteering her for stuff now because she's here. Hopefully she heard me.
Yes, I heard you. Hello.
Hey. All right, well, it's 2 after, so we'll go ahead and get started. Again, if you haven't already, put your name and organization in the chat box so I can have it for the record for attendance. We don't have a quorum here today, but I'm going to bring up my screen. Curtis, I'm going to let you open it and greet everybody, and then we'll share my screen here for our, oops, let me change this real quick. Everybody got big plans for the holiday weekend?
Rest.
Same here.
Yeah, I'm hoping it's
Brad and I are actually traveling to New Orleans for the homeless conference.
Oh,
the
really?
Conference. Yes, we leave tomorrow.
Wow. So it's actually in New Orleans?
Yes, this year it is. Last year it was in California, but we didn't go last year, but we are going this year to see if we can get some information with it.
Was it Department of Education or?
It's the national, hold on, let me get what the title is of it. It's the National Association for the Education of Homeless Children and Youth. So it's just something that our district usually,
Sure.
Or not district, but state usually pushes out for people to go, regarding homelessness. So we didn't get to go last year, but we're going to see this year what it's all about.
Well, and the reason I asked for a little bit more detail, I literally just got, and Curtis, I promise I'm going to let you take over in a minute. But I had just gotten a notice of funding availability from HUD. Now let me find it. And it was focused on youth. And it talked about creating capacity and structure and working with the school districts and all. I'm going to forward it out to everybody and see, because if it's something we might be interested in creating, and because it's federal funds, it could cross both. I mean, it could, serve both counties. And we'd have some infrastructure money and some capacity building money, which is something we don't usually get.
That's neat.
Where is it? Let me find it. So I'm gonna pull it up so it's at the top here. And of course, now I can't seem to find it, but I will find it and get it out to everybody.
Do anyone
we talk
knows
about-
what parade? Is it still
Sorry?
going on this weekend, the parade, Veterans Day Parade?
I heard yet this morning on the news that it was planned for this weekend. Yes.
Okay, okay. I haven't heard too much talk about it. I was just trying to.
I hadn't heard that. It was the first time I heard anything about it was this weekend. Was
oh,
this morning, which is a little unusual.
right, exactly.
Yes, I'm going to find that NOFA information. Okay, Curtis, I'm going to share my screen and so that way you see the agenda. Does everybody see the agenda? Yes, no, maybe?
Yes.
Yes. Cool. You have to call the meeting to order.
My turn.
It's your turn.
I just didn't want to interrupt you. All
I'm
right.
being recorded.
Hello, everyone. Glad to see everybody that could make it. We'll go ahead and call the meeting to order with the understanding that we do not have a quorum today, so no votes will be taken. And we'll turn it over to Ms. Pat Frey. Thank you, Pat.
Thank you. Thank you. And we don't really have anything to vote on today, which is a very lucky thing. But we do have quite a bit of stuff that's going on that we've been doing in the background. And now that we've had some reprieve and been able to close out some of our direct service grants, we've been able to focus on trying to get some of our committees a little realigned, restructured, and start getting some things on the calendar. So that being said, of course, we have our point in time count, which is coming up the 29th and 30th of January. Volunteer registration is underway already. We probably have close to 30 volunteers already, which is about half of the number that we will need. We usually use about 55 to 60 volunteers for our point in time count. But traditionally, about 20% of the people who show up for volunteer training don't show up. And then after you get through that, another 20% that have registered for the actual count don't show up. So if we need 55 to 60 volunteers, we probably need about 100 people to sign up. So putting it out there, the link here, and I will, as soon as we're here today, I'll go ahead and send you this this agenda. And I apologize, I didn't get it done in time to send it out. It was just too much going on. Which has the direct link to sign up for the training. Once you've completed the training, then we will sign everyone up for the count. Any questions about the count before we go over? And Sarah and Miss McBride, we're going to lean heavily on you guys to help us do a better job of Russell County. If you know of areas where folks may be, or if you've identified folks who are experiencing homelessness, we're going to lean on you heavily to help us make sure we make those connections for the point in time count. Going to move on to some of the COC committees. If those of you who were here last month, remember we talked about we wanted to have board membership or board member presence on each of our committees of our continuum of care. And to not only, of course, give support and leadership, but also to show the buy-in from the board to the committees and to be a liaison between the board, the committees, and others in the continuum. The Performance and Outcomes Committee, Tiffany and I have talked about this before, and Tiffany can't be here today, that she would serve as that representative on the board. There's some baselines that we're going to start looking at from a board perspective and from a COC perspective. And I don't mean that a baseline as we haven't done it before, but in our new monitoring, in our new enhanced monitoring of pulling in multiple data points at the same time, knowing where we are and where we're going to be, and using that information to use the HUD tool that does a needs analysis, looking at bed inventory, capacity, demographics, family makeup, and those kinds of things, so that we have a true analysis from a data perspective, and not a perspective of conjecture or just or personal interest, for lack of a better term. So Tiffany and I will be getting together in the next couple of weeks to finalize her team. There's some folks who are already suggested they wanted to serve, and there's some that we're asking to serve. Each of the committees will have 3 to 5 people, not big committees, because the bigger you get, the less you get done, honestly, but also because it's not a lot of work, but it's intensive, a couple hours, 2 to 3 times a year or quarterly. So making sure, but getting real information out of it. The Continuum of Care Application Committee has been meeting monthly, actually, since last November, because they were working on revisions to this past year's scoring for our Continuum of Care application. Because the application is so very similar to the other applications that the city does for HUD, we are suggesting, and I'm still waiting to hear back from Mr. Scott, if he would be willing to serve as the board representative for that committee. We're meeting monthly right now, and probably will be for another year, as one of the things that in addition to the scoring sheet that was modified for this year, it's going to be modified again for next year. We are holding ourselves more and more accountable for certain metrics that are directly related, obviously, to our Performance and Outcomes Committee. So these two will be working in tandem, but also in making sure that our programs are meeting the needs of the clients, and we're not asking clients to meet the eligibility requirements or to tweak themselves to meet the requirements of the programs. If we have programs that are not meeting the needs of the clients, then we need to change the programs. Also looking at reallocation, and for this group, we have $1.875 million that's available each year in our annual competition. That is broken down right now in 10 different projects. We're looking at each of those projects holistically, and then and individually and collectively. If we collectively have a performance improvement of, say, 2%, and we have one project who has the exact opposite, and they have their project performance is heading in the other direction, we're starting to take a look on a quarterly basis as to what's going on. There could be a number of factors, and this committee that's been getting together every month recognizes that if you're serving the hardest to serve, your metrics are not going to go up as quickly as those who are serving those who are easy to serve, because there's so many other barriers and so much that needs to get that, so many needs of those individuals and families. However, if you are serving the same demographics as everybody else, and your percentages are going in a different direction, then after 2 quarters of that, the committee is putting into place and into practice a what they're calling a probationary period. Excuse me. so that those that project is then brought in and sits down with the application committee, and everybody on the application committee actually has funding from HUD. So this is all of us monitoring ourselves. This is all of us saying, hey, we need our application to look good. And for our application to look good, all of us have to look good, which means we all have to perform accordingly. So after 2 quarters of poor performance, then that organization will be brought in to meet with that with the committee. After the 3rd quarter, that project actually would be brought in front of this board and formally notified that they may be at risk of their money being wholly or partially reallocated to another project in the community in the upcoming continuum of care application. I'd like to take a second to let that sink in and let folks think about that for a minute. Lakita, I know you were on the scoring committee this year. So if you have any thoughts, that's great. If not, that's fine too. But I want to let that sink in. We're at the point, not only in our community, but at the HUD guidance that can you give me an example of a project? Okay. When a project would mean, for instance, we have a rapid rehousing project that is at Open Door Community House that focuses on female-led households with minor children. Rapid rehousing is a project type from HUD that says you help with rent, utilities, security deposits, first and last month's rent, those kinds of things for up to a year. But you also have wraparound and mainstream services available to that family, such as making sure that they're enrolled in school, employment training, access to healthcare insurance, Social Security, food stamps, SNAP benefits, TANF, all of those other things. Because the goal is to bring someone in, increase their income, increase their access, and have them go their success rate and their self-sufficiency rate go from here to here. We're trying to leave people better than we found them. Did that answer your question, Sarah? Sarah, go away. Yeah. Okay, cool. So again, any discussion about or any concerns with the recommendations? Again, these are recommendations. They haven't been voted on. We don't even have them down in writing yet. We literally came to this conclusion yesterday with the committee, and I haven't had time to write them down. Any concerns about giving someone to that third quarter and then bringing them in, letting them know that they may have a decrease in money?
No,
don't sit here. Quiet. Go ahead, Keita.
No, I agree, because if they're not meeting those standards and those requirements that goes against HUD, then it can eventually affect us as a whole. So, bringing them in, allocating those funds, reallocating those funds elsewhere would definitely be beneficial to us and to the community.
Right, and that was very much the consensus of the group, because the way the HUD funding and through the continuum of care works, like I said, we have right now 1.875 allocated to our community, and it's based on last year's funding, any adjustments to fair market rent, and then any bonuses that you might apply for. So once you get the bonus, once you get the extra money, it's yours year after year after year. However, the reverse is also the same. So if Pat's ABC Rapid Rehousing Project was not increasing income, not shortening the length of time homeless, not getting access to health care, not making sure folks were in school. So, everybody else is scoring in the 70 and 80 percentile, and Pat's down there scored in the 35th. Well, at some point, that brings down the continuum of care score, because remember, it's a competition. So it brings down that continuum of care score as it relates to everybody else in the country. So if we're less than that median, that money that's at the bottom there, at least 6% of that goes away. This year, we could potentially, if we don't score like we think we will, it will be a little bit over $100,000 and 6% of $1.87 million. So again, making sure that we're holding accountable, and even if you score low, but you have in place and you can show this happened here, we did this, we did this, we did this, we did this, not just saying we have this really pretty policy and that, but we didn't do anything about it. But saying on this date, this was done, on this date, this was done, on this date, this was done. And so, you know what? Sometimes you can't control some exterior factors. And it may be your length of time homeless is way up because of available vacancies or whatever. Very possibly true. But you showed the earnest, you showed the effort in and the good faith to put steps in place and to make and to document all the things you did to try and negate that. That goes a long way. So again, I didn't want to beat the dead horse, but I did want to talk about that, because when you start talking about money, people get funny and rightfully so. However, when we start talking about government money, I get funny because I have to sign the contract.
Right. And I think another thing we need to take in consideration that, you know, one organization may not see this specific type of population that was put in the, you know, outlined in their policy or whatnot regarding women or homeless women, but another organization may see more people. So they need it more than others. So just being open to that and just, you know, keeping that in mind as well.
Yes. Very, very good point. Very good point. So I'm going to go back and try and share my screen again. There you are. All righty. So then the next one, Kristen, this is the one you and I talked about 2 months ago, about working with mainstream and outreach, making sure that we're connecting people with job fairs, resource fairs, training, those kinds of things. And I added this afternoon as I was trying to rush to get ready here, Kristen, was I would love to use our system, our HMIS system, to track those who participate in these different types of programs across the board. I know we do it with anybody that works with, whether it be you at Better Works or with Briggs and Associates or whatever, we track it, but we haven't done that across the board with every participating agency in HMIS. Thoughts on that?
I mean, I absolutely think it's a great idea. So yeah, definitely worth talking about, probably bigger than we even realize when we think about it. But yeah, because you're already doing it at some level, it would just be a matter of getting everybody on board. Remind me who is leading that committee? I haven't gotten any communication or any messages about
the person who was doing it is no longer with in the Continuum. Okay. So we're gonna move some things around, but we got someone in mind. We're waiting to hear back. So,
okay, sounds good.
Yep. And because you have your pulse on the job fairs and the trainings and everything else, it would probably be making sure that someone's connected, and then after that is just the oversight. But I think the tracking is really important. And one way we may be able to do this, now that I'm thinking about it, rather than, you know, whether someone brings in, you know, participation card from an event or whatever, our friends over at Safe House already have community access cards that are their ID cards with a barcode.
Okay.
And if we set up a scan station at a job fair, a resource fair, or whatever, boom, 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 it would automatically load to the system.
Okay.
Yeah, so we could do that, pretty quickly. Yeah. All right, our HMIS data committee. They meet quarterly now. We're doing some upgrades and some updates to the HMIS policies and procedures, and turning up the turning up the heat a little bit when it comes to data quality, only allowing for 3% error rate and taking the time it takes to, or time you're allowed to take to put in information from 7 days to 3 days. We will be presenting that in form of a resolution in front of this group in January for vote in January by this group, but by full approval of our COC membership in our semi-annual meeting in February. We're looking at project reviews and updating all of those at that time of the year, and looking at least quarterly training for all of our providers and all of our users every year, and looking at a better way to conduct either our desk audits or our on-site audits. Dr. Tequila Nelson will be helping to advise that, as a lot of the data and a lot of the work that they're doing at the school district very much mirrors HMIS, and we're looking to see how we can share data and make sure that we're serving all of the clients and no one's dropping through the cracks. Any questions, concerns on that one? And Lakita, I did not have a chance to send this over to you earlier, but with what you do with the VA and how you do screenings and you deal with people in a crisis mode, it makes only sense. I'm not going to put you on the spot and ask you to say yes or no, but trying to get someone who does this for a living and works with people in crisis to look at, because coordinated entry is the access to our crisis response system. It's 211. So looking at how we do that, how we're having to change our policies and procedures. I just was meeting with the director. They're wanting to take some things in a direction that we're going to need to get some advice from board. We're going to need to get some advice from HUD if that's going in the right direction on that, because we in another year or so, we're going to have very, very stringent HUD guidelines on coordinated entry. For years, it's been pretty much, as long as y'all are doing something, they're going to get pretty, excuse me, it's a sinus, pretty picky here soon. So we'll talk later, but it's suggested that you might be the best fit. And Curtis, you're a point in time guy, and you've been that for a couple of years now, and you haven't messed up too bad, so we'll let you hang out. They've already started meeting. Holly Browder from Parks and Rec is our chairman of that committee. We met with her earlier. Actually, we started meeting with her in October. Supposed to talk with her next week just to finalize some things. Volunteer training, coordination. Curtis always does a really good job of helping us make sure we get our law enforcement guys lined up for the unsheltered count. Location verification, we'll lean on everyone here, our law enforcement folks and all of our service providers. And we really always want to do a good job of marketing and public awareness on that. Our new lived experience committee, we have not actually kicked that committee off yet, and it was a spelling error. But one of the things that was suggested when we put this together was that those with lived experience, those who have recently been in the trenches and lived either on the streets or in shelters, and have still have real connections and colleagues out in the field, can start conducting some focus groups, customer service surveys. That's not me or you asking someone a question, but it's their friend, it's their buddy, it's the guy they used to go and stand in line at Salvation Army with or whatever, that's doing these surveys and looking at that because it's time to do our community needs and priorities again. It's been almost 2 years. So, and Dr. Gloria Rogers has been suggested, and she's committed to help serve on that group. And in fact, the chair of that committee is going to be Melissa, who has just joined the Home for Good staff. Melissa has lived experience and is our lead for our new PATH team implementation. So she'll be heading up that group. And then the last one is our landlord engagement. Shannon Smallman has already agreed that she would help us to recruit landlords, train landlords, do some training and look at things from a more holistic approach. I think you guys have seen that over the past couple weeks, I've been sending out some information, some articles and those kinds of things, trying to get outside of our box, look at things a little bit differently. We're being approached to ask questions and to seek opportunities for funding and for partnerships to start creating or rehabilitating housing, so that we can increase the number of available units that are safe and affordable. That's all I have for the committee updates. Any questions on that? So quiet. All right, Carla, I know I asked you to remind me, and I went ahead, excuse me, and I went ahead and put it on here too. There are several of you that I don't have a conflict of interest or code of ethics. I'm going to attempt to get those out, second copies to everybody today before I leave for the long weekend, just to make sure that we have an update one for everybody.
So Pat, I don't remember, would you just want us to sign them again if we did it already? If we think we did?
I think I have yours, Kristen, but I'll look.
Okay.
I left this in here from last month, if you will remember. Coordinated entry when it moved back, when it came to Columbus or came home from Atlanta, they had some capacity issues and or just trying to get their feet wet. We had to amend the coordinated entry policies and procedures that said that the organization 211 would contact the client or the potential client within 1 business days to 5 to 7 business days, because we could not meet the guidelines. I was informed earlier today that they think they are ready to go back to the previous guidelines of within 24 business hours. I left it on here to remind myself to ask in writing for the 211 information and referral manager and director to let us know that they are ready for us to take to amend our policies and procedures again to the original 24 business hours. There are some other concerns about some changes that they're wanting to make for efficiencies in 211. I'm going to ask that we get some input from some technical advisors at HUD before we make any of those adjustments. Any concerns about bringing on the technical advisors, or do you think, or any concerns or whatever? Wow, don't everybody speak at one time.
It sounds like we all trust your guidance and great leadership, Pat. We're fine
No.
with that.
Well, it's
See the
just that,
value.
you know, I think, you know, I think everybody here knows I'm pretty, you know, head straight ahead, and we're doing this and we're moving along. And then, you know, there's different ways to look at it. And sometimes you've been in it too long. You've been working it one way for so long, you don't see another option. But also, I think you don't just change something to change something. So to get an outside perspective, not a 211 perspective, not a Home for Good perspective, but a HUD technical advisor. Hey, this is what's coming down the pike. Have you thought about this perspective? I think to bring in, and we had a technical assistance person, Natalie, when we started this process back in 2016, 17, who actually ended up being the one who Natalie heads up the HUD calls every other week. And we were able to do a presentation with her on our coordinated entry implementation at a national conference. So think we can trust her to give us a good perspective. So I'll be reaching out to her so that way we can get some advice.
Yeah, I do think it's wise to get that input. I was going to ask, so on the back end of that, once you get advisement from her, how is that typically used? Like, do you bring a group together to take that into consideration with all of those perspectives, or?
That would be the coordinating committee. Yes, ma'am.
Okay.
Yes, ma'am.
Yeah.
Okay. Yeah. Because, okay, her perspective, she helped to develop the coordinated entry that was used by Houston, Texas, which was labeled as the gold standard. So what we did was we said, okay, show us how to do what they did. And we literally mirrored what they did and have grown it from there. But it was all done within, it took us about 11 months from start to finish. And we were able to implement prior to the deadline that HUD had set to have something in place. They didn't tell you what, they just need to have something in place so that everybody was accessing the system the same way in an equitable fashion. Interestingly enough, when I was in Philadelphia 2 weeks ago, I was talking with the lady from the United Way of something in Arkansas. Don't ask me. I can't remember I've got her card here somewhere. And she was telling me that they are just now getting started on coordinated entry. They couldn't figure it out till just now. So we're real proud of where it's been, but I think having an advisor to take us to the next level is really what we need to do. In concert with that, I think we'll pull in our HMIS, which is our client track folks, so that we can talk about as much automation as possible. Because if the less we have people touching the data, I think the more accurate and the more efficient it's going to be. And then I have two other things, and then I'm really going to hush. Second chance vouchers, and our next step vouchers. Our second chance vouchers, for those of you who may not know, are a collaboration between the Housing Authority of Columbus and the COC. It's for those who are leaving a correctional facility, and within 90 days of leaving the correctional facility, meeting some eligibility requirements, income eligibility requirements, and not being registered sex offenders, and not having, manufacture of methamphetamine, or violent crime within the past 5 years. These we'll have up to 10 vouchers a year that we can 10 vouchers that can be used for those coming out of incarceration for up to 2 years of rental assistance. So this individual or family will be able to get rental assistance for up to 2 years, but also those wraparound case management, mainstream services for healthcare, employment, education, everything that everybody else is. But this is mandated. This is mandated case management. We're working obviously with the Housing Authority. I think we've just worked out the last couple of the details of dotting the I's and crossing the T's. And working out how we start making sure that those referrals happen. Kristen and I have been working on some forms with Department of Corrections and the Muskogee County Jail, to make sure we have folks who are re-entering. But one of them, they will complement each other, but one of them doesn't rely on each other. So we'll be doing referrals probably in the next couple of weeks to make sure that folks coming out of incarceration have a place to go, should they need one, have some assistance to get them back on their feet, and hopefully break the cycle of recidivism. The other interesting one is that for the first time in probably, I think, 4 years, Carla, we were able to issue a voucher for a young lady who was aging out of foster care. Again, another partnership that the Housing Authority of Columbus started. And we're having some difficulty in getting some things going, or getting the referrals from Department of Family and Children's Services. We sort of worked around it on this last one. And at my trip to Philly 2 weeks ago, met with the folks from the Hialeah Housing Authority and Citrus Healthcare Network. We're going to be partnering with them to learn some best practices. Yes, we're going to steal their policies and procedures and all those other things to make sure, because that's all that they do is work with families who are aging out of foster care or are involved with the Department of Family and Children's Services, whether it's, someone's going to lose their kid because of housing or those kinds of things. That's all I have on my agenda. It's back to you, Curtis.
All right. Thank you, Pat. That information on the vouchers, can we get that to Mr. Wade, who, handles our program for those people that are getting?
Yes, sir. Yes, sir.
That way we can,
John and I, we've talked about it a few times, but yeah, I'll remind him. Yep.
okay. That's it. Does anyone else have anything to add to the group today? All right,
Hey,
do I have,
Jennifer, I'm sorry, I was just making sure I had everybody on here. Sarah, Mary, Carla, Lakita, Kristen, did you sign in?
Probably not. I think I joined after. Here, I'll throw my.
Yeah,
throw my
that way I
number.
just have everybody's documented attendance. Yay.
all right, if there's nothing else, do I have a motion to adjourn?
So motion.
Is there a second?
I second.
All right, the meeting is adjourned. Thank you all, and we'll see you next time. Pat,
See you
yeah,
guys.
I'll get with
Thanks.
Holly about all the details for a point in time so I can go and push it out.
Actually, yes, we'll start creating the letters that we send out next week.
Okay,
Yep, I'll send them to you first for review.
all righty.
Thanks, sir.
All righty, thank you all. Y'all have a
Thanks,
good one.
ladies.
Be
See
safe.
ya.